Top 12 causes of skin cancer you should know. Skin cancer is a type of cancer that affects millions of people worldwide. While it is one of the most common types of cancer, it is also one of the most preventable. However, in order to prevent skin cancer, it is important to understand its origins and the factors that contribute to its development. Today, we will discuss the top 12 causes of skin cancer that everyone should be aware of in order to protect themselves and their loved ones from this potentially deadly disease. Just a quick reminder, we are not doctors, and the information provided in this video should not be considered as medical advice. This video is intended for informational purposes only. Now let's dive into these causes. Number 1. The sun's harmful UV rays. Exposure to the sun's harmful ultraviolet UV rays is one of the most significant factors contributing to skin cancer development. The sun emits UV radiation that can penetrate the skin and damage DNA in skin cells. This damage is a primary cause of mutations that can lead to skin cancer. Not only does long-term exposure to sunlight increase the risk, but also short bursts of intense exposure that result in sunburns are particularly harmful. Even on cloudy days, up to 80% of UV rays can pass through the clouds, making sun protection essential year-round. The risk of damage is higher during the middle of the day, when the sun's rays are most direct. Reflective surfaces like water, snow, and sand can also increase UV exposure by reflecting the rays back onto the skin. It's important to understand that while the warmth and light of the sun can be enjoyable, the invisible UV radiation carries risks that warrant protective measures, such as wearing sunscreen, seeking shade, and wearing protective clothing to minimize skin cancer risk. Number 2. Tanning beds and UV lamps. Tanning beds and UV lamps are significant sources of artificial ultraviolet radiation, closely mimicking the sun's natural output. Frequent use of these devices for skin tanning increases the risk of developing skin cancer, including melanoma, the deadliest form. The intensity of UV radiation from tanning beds can be much greater than that of the sun at its peak, leading to quicker and more severe skin damage. Recognizing the danger, numerous health organizations have classified tanning beds and UV lamps as carcinogenic to humans. Young individuals, especially those starting under the age of 30, are at a higher risk when using these artificial tanning methods, accentuating the importance of avoiding them to protect skin health. Number 3. Fair skin, freckling, and light hair. Individuals possessing fair skin, freckling, and light-colored hair, such as red or blonde, face a heightened risk for developing skin cancer. The lighter pigmentation offers less protection against the sun's UV rays, allowing for more significant DNA damage in the skin cells. This susceptibility is further pronounced for those with blue or green eyes who naturally absorb more sunlight. Moreover, people with fair skin often experience a higher incidence of sunburns and freckling, which are indicative of skin damage from UV exposure. Freckles, in particular, can be a sign of an increased risk of skin damage from the sun, as they typically form as a response to UV radiation. The propensity for light skin to burn rather than tan is a critical factor in the elevated risk of skin cancer among this demographic. As such, individuals with these characteristics should exercise rigorous sun protection measures, including the regular use of sunscreen with a high SPF, wearing hats and protective clothing, and avoiding peak sun exposure times to mitigate their increased risk of skin cancer. Number 4. Family history of skin cancer. Having a family history of skin cancer significantly elevates an individual's risk of developing the condition themselves. This increased risk can be attributed to a combination of genetic predisposition and shared environmental factors, such as a family tendency towards prolonged sun exposure or possessing lighter skin tones that are more susceptible to UV damage. Gene mutations linked to skin cancer risk can also be inherited within families, further amplifying the likelihood of developing the disease. For those with a family history, especially involving close relatives like parents, siblings, or children who have been diagnosed with melanoma or other skin cancers, taking proactive steps towards skin health becomes even more critical. Regular self-examinations of the skin to check for new moles or changes in existing ones, along with professional skin evaluations by a dermatologist, are vital practices. Number 5. Personal history of sunburns. People who have experienced sunburn are at an elevated risk of developing melanoma, a dangerous form of skin cancer, compared to those who have never been sunburned. The likelihood of melanoma increases with the number of sunburns one has had throughout their lifetime. Importantly, this heightened risk applies to sunburns acquired at any age, emphasizing that damage from UV exposure accumulates over time, irrespective of when the burns occurred. Before we dive into the next cause, I want to remind you to subscribe and like this video if you haven't done so yet. Your support helps us keep delivering valuable content for you. Number 6. Certain types and large numbers of moles. Having a significant number of moles or moles that are unusually shaped can heighten the risk of developing melanoma, a type of skin cancer. Research indicates that individuals with 100 or more common moles carry a greater risk of melanoma compared to those with fewer moles. While having a large quantity of moles does not guarantee the development of melanoma, it necessitates a heightened vigilance towards sun protection and regular monitoring of the skin for any changes. A typical mole syndrome, characterized by the presence of moles that are large, over 5 mm across, or irregular in shape, further amplifies this risk. Number 7. Age. Age plays a crucial role in the risk of developing skin cancer, with the likelihood increasing significantly as one gets older. Non-melanoma skin cancers are more prevalent in individuals over 30 years of age, showcasing a direct correlation between age and the risk of this disease. However, it is essential to recognize that skin cancer does not discriminate by age and can affect younger populations as well. Melanoma, while increasing in likelihood with advancing age, is also a concern for younger individuals. Statistics from the UK reveal that approximately 30% of melanoma cases occur in individuals aged 75 and above. Despite this, melanoma stands out as it is more commonly diagnosed in younger people compared to most other types of cancer. Number 8. Human papilloma virus. Human papilloma virus, HPV, is implicated in a variety of skin conditions and cancers, acting as a significant risk factor in the onset of certain skin cancers. Infection with specific strains of HPV, notably those causing conditions such as cervical cancer, genital warts, and epidermodysplasia verruciformis, has been linked to an increased likelihood of developing skin cancer. Genital warts, most commonly caused by HPV types 6 and 11, do not directly lead to skin cancer, but indicate the presence of HPV, which can affect skin health. Furthermore, individuals with epidermodysplasia verruciformis, a rare condition that makes skin highly susceptible to HPV, are particularly prone to developing skin cancer. Bowen's disease, characterized as an early form of skin cancer, can emerge in the genital area and is associated with HPV infection. Research highlights the connection between HPV and an elevated risk of Bowen's disease, underscoring the virus's role in skin cancer development. Number 9. Chemical exposures. Certain occupations that involve working with specific chemicals significantly raise the risk of skin cancer. Employees in industries handling coal tar, soot, creosote, and various petroleum products, including mineral oil and motor oil, as well as those exposed to shale oils and arsenic, are at a heightened risk. The carcinogenic nature of these substances can lead to direct damage to the DNA of skin cells, thereby increasing the likelihood of skin cancer development. It's crucial for individuals working with these chemicals to adhere to safety protocols and use protective gear to mitigate their exposure and safeguard their skin health. Number 10. Previous radiation treatment. Previous radiation treatment for cancer or other medical conditions significantly increases the risk of developing skin cancer in the treated area. Radiation therapy, while effective for targeting and killing cancer cells, can also cause DNA damage in surrounding healthy skin cells, potentially leading to skin cancer. The risk varies depending on the radiation dose and the area treated, with higher doses and repeated treatments contributing to a greater likelihood of skin cancer. Individuals who have undergone radiation treatment should be diligent in monitoring their skin for any new or changing lesions and consult with their healthcare provider for regular skin evaluations. Number 11. Immune system suppression. When individuals undergo treatments or have conditions that compromise their immune system, their susceptibility to skin cancer escalates. Chemotherapy, certain medications, and autoimmune diseases that lead to immune suppression can significantly increase the risk of skin cancer. This is particularly true for those who have received organ or bone marrow transplants and are on anti-rejection medication, as well as individuals living with HIV AIDS or chronic inflammatory diseases like inflammatory bowel disease. The compromised immune system is less capable of repairing DNA damage in skin cells and fighting off early forms of cancer. Consequently, national health guidelines strongly advise that patients with compromised immune systems, especially transplant recipients, undergo annual examinations with a dermatologist. These checkups are crucial for early detection of skin cancer symptoms, enabling timely treatment and improving outcomes. Number 12. Smoking. The connection between smoking and skin cancer, particularly squamous cell carcinoma, SCC, has been highlighted by various research, including the Leiden skin cancer study. This extensive study involving 1,126 participants underscores smoking as a notable risk factor for developing SCC, which ranks as the second most prevalent form of skin cancer. Intriguingly, the study suggests that the mode of tobacco consumption influences the level of risk. For instance, smoking pipes is associated with a greater risk compared to cigarettes. The harmful chemicals in tobacco smoke can directly damage the DNA in skin cells, increasing the likelihood of mutations that lead to skin cancer. Furthermore, smoking may weaken the immune system, further impairing the skin's ability to repair DNA damage and fight off cancerous cells. This evidence reinforces the importance of smoking cessation as a vital preventive measure against the development of squamous cell carcinoma and underscores the broader health benefits of quitting smoking. Remember, we're not medical professionals, and the information shared here should not be taken as medical advice. This video is solely for informational purposes. We hope you found this video informative. Discover more captivating health and wellness content by subscribing to our channel and exploring our other engaging videos.